Pandemic continues. Imagine a drug that would keep you from getting sicker if you are diagnosed with COVID-19. News 3 reporter Zach Dahlheimer explains.
Kind of a dream of every scientist to make a discovery that can impact human health.
Dr. Alban Gaultier recalls what he found at the University of Virginia.
It was kind of by accident.
It involved the antidepressant fluvoxamine, also known as Luvox, capable of possibly stopping sepsis.
It's actually prescribed for treating anxiety disorder. When we tested fluvoxamine in our animal model of sepsis, we discovered that fluvoxamine was very good at protecting from sepsis symptoms.
This led to a virtual clinical trial by researchers at Washington University in St. Louis looking into whether the drug can benefit those diagnosed with COVID. Gaultier says some newly diagnosed patients were given the drug to take twice a day. They reported their symptoms through an app while researchers measured for clinical deterioration.
Decrease in oxygen level in the blood and difficulty breathing, and of course hospitalization. Out of the fluvoxamine group, it was 0. None of the patients presented with clinical deterioration.
Now researchers are performing another virtual trial with patients in Virginia and around the country with underlying conditions.
Researchers will track patients by video chat, email, or phone to find out if the drug benefits them and helps keep them out of the hospital.
It's clearly a game-changing type of clinical trial format. If the clinical trial is successful, fluvoxamine will be given to patients that present with symptoms very early in the disease. So the value will be 1, preventing the patient to go to the hospital, and 2, also unloading the hospital from the incredible burden that they are suffering now.
Gaultier says it would be a win for research and in the fight against COVID-19.
Now it's time for the population to help the scientist and the doctor put the dot at the end of the sentence, which is fluvoxamine can or cannot be a treatment for COVID.
Zach Dahlheimer, News 3.